This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, June 16th, and I'm Zach Caruso. Our lead story this week is in the Journal of Addiction Medicine and is titled Benzodiazepine Tapering, Evidence Limitations and Research Recommendations. This systematic review of publications from 2000 to 2023 concerning tapering benzodiazepines was used to inform the Joint Clinical Practice Guideline on benzodiazepine tapering, published in 2025. Rates of taper were often faster than recommended, such as 25 to 50% reduction in the initial 1 to 2 weeks. There was little information on long-term outcomes such as protracted withdrawal and quality of life, and some studies had high rates of attrition. Patients were often switched from short to long-acting benzodiazepines. However, there are no data on the effect on withdrawal severity or outcomes. There is little information about adverse events such as mortality and suicidality, despite insurance data associating discontinuing benzodiazepines and mortality. The authors conclude the evidence base for tapering benzodiazepines is deficient and list 10 areas for future research. Next is an article in JAMA Psychiatry and is titled Evaluating Reduced Use and Abstinence as Outcomes in Pharmacotherapy Trials for Stimulant Use Disorder, a meta-analysis of 12 randomized controlled trials. This meta-analysis of 12 randomized controlled trials assessed if pharmacotherapies for stimulant use disorder show evidence of benefit when reduced use is elevated as an outcome. Researchers found that no medication demonstrated a significant benefit over placebo for abstinence. When reduced use was elevated, pooled treatment effects remained non-significant. However, effect size estimates were consistently larger in magnitude than those observed for abstinence, and a positive signal for reduced cocaine use was observed for cabergoline in medication-specific analyses. Evaluating reduced stimulant use alongside abstinence may provide additional clinically relevant information for interpreting treatment effects in pharmacotherapy trials for stimulant use disorder. Our next article is in Drug and Alcohol Dependence and is titled Pharmacokinetics of Xylazine and Fentanyl in Patients Presenting to the Emergency Department After Non-Fatal Opioid Overdose. Alpha-2 agonists as adulterants in the fentanyl drug supply may complicate overdose treatment and have other health effects. While the pharmacokinetics or PK of xylazine among animals is established, the PK in humans is less well understood. Researchers conducted a PK study including 13 patients after overdose and who were positive for both fentanyl and xylazine. Researchers found that the half-life of xylazine was 345 minutes with a margin of error of plus or minus 145 minutes, which is much longer than found in animals. The researchers also noted potential side effects of xylazine and found about half of patients had hypotension and bradycardia, while 84% had hyperglycemia. The authors note these findings help support clinical management of patients exposed to xylazine and also suggest future studies examining xylazine related to hyperglycemia. Our next article is in Addiction and is titled Comparative Effectiveness of Alternative Times to Opioid Agonist Treatment Taper Initiation on Taper Completion and All-Cause Mortality Among People with Opioid Use Disorder, a retrospective population-based target trial emulation study in British Columbia, Canada, 2010 to 2020. While treatment guidelines recommend long-term use of MOUD, some individuals wish to taper off treatment. Researchers conducted a retrospective observational study emulating a target trial to compare taper completion and all-cause mortality based on the time frame of starting taper after MOUD. Initiation of a taper for buprenorphine or methadone in any time frame less than 12 months was associated with greater likelihood of completing the taper, but also with an increased all-cause mortality. The authors note that while individuals may desire to taper off MOUD, these findings do support guidelines that recommend at least 12 months of stability on MOUD. Next is an article in the International Journal of Drug Policy and is titled Provision of Safer Smoking Equipment to Reduce Health Harms and Enhance Service Engagement Among People Who Use Crack, a realist-informed review. For this review paper, researchers included 16 peer-reviewed studies and 6 gray literature studies to synthesize the evidence on safer inhalation equipment provision for people who use crack. The studies found that safer inhalation interventions were highly acceptable and led to reduced pipe sharing, decreased injecting, and improved engagement with health and social services. Studies highlighted several implementation challenges, including limited resources, political barriers, and logistical constraints. The authors found that accessible, integrated, and peer-supported delivery models facilitated effective safer crack use interventions. Next is an article in the New England Journal of Medicine titled Detecting Gambling-Related Problems, an Opportunity to Reduce Suicidality. Changes such as legalized sports betting, online gambling, and prediction markets have increased opportunities for risky gambling behavior. Gambling disorder can result in financial difficulties, damaged relationships, and suicidality. Most people with gambling problems have a coexisting disorder such as depression, mania, or alcohol dependence. Gambling problems are often considered outside the scope of traditional medical care. In this perspective article, the authors call for screening for gambling problems using one of several existing screening tools. Treatments include cognitive behavioral therapy, motivational interviewing, and self-help groups. There is even some evidence of efficacy of naltrexone. The authors call for the healthcare system to respond to the increase in opportunities for gambling and gambling problems. Our next article is in the Journal of Addiction Medicine and is titled Postmortem Toxicology Positivity for Medications for Opioid Use Disorder in Illinois Unintentional Opioid Overdose Deaths 2019 to 2024. Our next article is in the Journal of Addiction Medicine and is titled Postmortem Toxicology Positivity for Medications for Opioid Use Disorder in Illinois Unintentional Opioid Overdose Deaths 2019 to 2024. For this retrospective cross-sectional study, researchers analyzed unintentional overdose deaths in Illinois to characterize demographics and MOUD detection in fentanyl-attributable opioid overdose deaths, or OODs. Using data from the Illinois statewide unintended drug overdose reporting system from 2019 to 2024, the authors found there were 17,000 unintentional OODs with 73% attributed to fentanyl. Of those who died due to OOD, the median age was 44, 75% were male, and 45% were white non-Hispanic. Detection of any MOUD was low throughout the study period. Methadone detection was associated with a lower risk of fentanyl-attributed OOD, whereas buprenorphine and naltrexone were not significantly associated with a lower risk of OOD. Our final article is in Translational Psychiatry and is titled Differential Alterations in Peripheral Tryptophan Pathways in Methamphetamine versus MDMA Users are linked to their contrasting psychiatric symptoms. Methamphetamine, or meth, and MDMA are structurally similar amphetamines with markedly different clinical effects and addictive profiles, potentially mediated through tryptophan or TRY metabolic pathways. This study compared serum TRY-related metabolites in chronic MDMA users, meth users, and healthy controls using ultra-high-performance liquid chromatography mass spectrometry. Results showed distinct alterations between groups, with meth use associated with reduced TRY and serotonin levels and increased activation of kynurenine pathways. In contrast, MDMA use was linked to selective activation of the hydroxylated kynurenine branch. These metabolite changes correlated with depression and psychosis severity, suggesting that differential TRY pathway alterations may underlie substance-specific neuropsychiatric effects and represent potential therapeutic targets. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.